Hello, my name is Laren Dolans, and I'm a diabetes educator at Fort Washakie Health Center. November is National Diabetes Month, but as a diabetes educator, I know that every month and every day is important to control your blood sugars. In the next few minutes, I'm going to give you information that can help you control your blood sugars and live healthy with diabetes. What can you do to live healthy with diabetes? Well, the American Association of Diabetes Educators have come up with a plan. They are called the AADE7 self-care behaviors. These are the things that you can do on a daily basis to control your diabetes and help manage your blood sugars. Let's learn more about them. The 7 self-care behaviors are healthy eating, being active, monitoring, taking medication, problem solving, healthy coping, and reducing risks. Sounds like a lot, right? Well, if we break them down over the next few minutes, you will learn more about them, and then you can make an appointment with a diabetes educator to learn how to use them in your own daily life. The first behavior is healthy eating. What is healthy eating? If you were to ask 10 different people on the street what healthy eating is, you would probably get 10 different answers. So what is healthy eating? As a diabetes educator, my job is to learn what foods you like to eat, then teach you what foods raise blood sugar and what foods do not raise blood sugar. Most people do not realize that not all foods raise blood sugar. After I teach you how food affects blood sugars, then you will be able to come up with an overall healthy eating plan that works best for you to control blood sugars. The next self-care behavior is being active. Being active is good for all ages, but especially good for those with diabetes. There are many benefits from being active and regular fitness activity. Let's go over a few of them. First of all, physical activity helps lower blood sugars. If a person simply goes for a 30-minute walk, they can lower their blood sugars as much as 20 to 40 points. Give it a try sometime. Test your blood sugar, then go for a walk. When you return, check it again and see how much it went down. Regular physical activity also has long-term benefits. It strengthens your muscles, even your heart muscle, makes you more flexible, and can improve your balance. Physical activity is not only good for your body, but it is also good for the mind. It can relieve stress that is sometimes related to high blood sugars and makes you mentally strong. Before starting a regular physical activity, you will want to check with your provider to see if there's any limitations to be aware of. Monitoring your blood sugars on a daily basis can also be valuable. In my 15-year career with the Indian Health Service, I have noticed that most patients do know how to use their glucometer. However, many have never been taught how to use the numbers they get from their glucometer to manage their blood sugars. The glucometer can be helpful in providing information about food, exercise, medication, stress, sickness, and other factors. Using your glucometer reminds me a lot of beadwork. Someone who beads has a beautiful pattern in their mind, but unless they put the pattern into their artwork, you and I would never be able to enjoy it. Likewise, when you write your blood sugars down into your sugar log, your provider and I are able to see patterns occurring and then are able to adjust your diabetes care plan to help you balance your blood sugars. Taking your diabetes medication on a daily basis is also important. Nowadays, we have quite a few medications that can control your blood sugars. Some medications are taken by mouth and others injected. Insulin is an example of one that is injected. Something important to understand is that insulin is a natural way the body controls blood sugars, and it is the most effective. That means insulin lowers blood sugars more than pills that you take by mouth. Most medications work differently. Because of this, sometimes it is best to be on several types of medication for the same condition. So oftentimes a person may be on oral medication and insulin at the same time. For example, the medication metformin helps insulin work better. One reason it is important to take your medication every day is because once the medication is out of your system, anywhere from 6 to 24 hours depending on the medication, the benefits go away. Another thing to remember is that our bodies are always changing. Because of this, it is important to make regular checkups with your provider to make sure you're on the right dose. Sometimes it needs to be adjusted. Also, since medications cause side effects and interact with other medications and traditional medication, it is important to discuss these things with your providers and pharmacists. Problem solving is another valuable skill to have. What we have learned in the past 20 years is that the more you know about diabetes, the healthier you can be. Diabetes is a disorder where you manage your own condition with the help of your provider and care team. However, your care team does not go home with you, and you may not be able to ask them questions when clinic hours are closed. So learning problem-solving skills can be valuable to you as you navigate through your diabetes care plan. As a diabetes educator, I teach you these skills that can help you overcome barriers that you're having managing your blood sugars. Healthy coping is another important skill to learn about. Sometimes our minds are our worst enemies, so keeping a positive mind frame is very important. Healthy coping looks at the whole person. It takes into account the body, mind, and spirit. Sadness, anxiety, and stress all affect blood sugars, and it is not good to ignore them. Healthy coping helps you stay strong and gives you the endurance for the journey. Here are some examples of coping skills. Establish a partnership with your healthcare team. Spend your energy wisely. Find a support friend. Don't worry about things that you don't have control over. Learn to grieve. Work with your behavioral health team member. The last self-care behavior I would like to talk to you about today is reducing risks. Uncontrolled blood sugars over long periods of time can increase your risk or make it easier for certain conditions associated with diabetes. This may include concerns about the eye, kidney, heart, teeth, and gum. By managing your blood sugars, you can reduce the risks of these conditions. Other ways you can reduce your risk is by avoiding unhealthy behaviors such as smoking cigarettes and drinking unhealthy drinks like regular soda pop, fruit juices, and sports drinks, which all have hidden sugars. See your healthcare provider 4 times a year, and you will be able to keep on top of your health and reduce risks. There you have it, the American Association of Diabetes Educators' self-care behaviors. If you want to learn more about them, feel free to make an appointment for your diabetes education at Fort Washakie. You can do this by calling your care team nurse or by calling Tricia Stiffarm at 335-5948. I look forward to meeting you and have a good day.